Good day, fellow learners. This is your mentor, your fact check buddy, Ray Gapuz, joining you for another PECHA KUCHA session. Well, for today's PECHA KUCHA, we're going to talk about a concept that a lot of us who are preparing for the NCLEX, especially those who are not familiar with the test content and framework, they missed on studying concepts related to multidisciplinary team and conference, or interdisciplinary team and conference, or transdisciplinary team and conference. In essence, they forget to study this concept that we're about to cover on our PECHA KUCHA number 7. So before we get to start, let me first share with you what a PECHA KUCHA is. It is a format of storytelling that utilizes 20 slides, with each slide being commented on for a maximum of 20 seconds. The method usually lasts for 6 minutes and 40 seconds. So how about that? You'll be able to master 20 concepts in 6 minutes and 40 seconds. So, without any further discussion, here we go. Before we get to start, I'd like to ask you to join us in this mission. Our goal is to provide free NCLEX RN application review to 100 nurses. And to help us achieve this, just watch and finish the ads in our videos. Thank you. Let's go. Okay, the first one would be optometrist. So the optometrist is a doctor of optometry. So they're not doctors of medicine. So the main responsibility of the optometrist is to prescribe corrective lenses and glasses. So patients with astigmatism and those with dry, age-related macular degeneration should be referred to the optometrist. Next, the ophthalmologist is a doctor of medicine specializing in disorders of the eyes. So what can they do that the optometrist can't do? Ophthalmologists can perform eye surgery. So those with wet age-related macular degeneration should be referred to the ophthalmologist. Next, the optician can work with the optometrist and the ophthalmologist. They are technicians and their main responsibility is to fit vision correcting devices like eyeglasses. So they're not doctors. And but they can work with the ophthalmologist and the optometrist. Next, the podiatrist is a doctor of podiatric medicine. They're not doctors of medicine. So they're responsible for the treatment of disorders of the foot, the ankle, and related leg structures. Now, primarily, you refer somebody to the podiatrist with numbness, bunions, or those with diabetes mellitus. Next, chiropractor. Once again, these professionals are doctor of chiropractic medicine, not necessarily doctor of medicine, but chiropractic medicine. So they diagnose and treat musculoskeletal conditions. They cannot prescribe medications, even muscle relaxants. What they can prescribe would be the use of braces and support devices. Next, the physical therapist is the professional that helps injured people, first to improve movement and to manage pain. So patients' interaction with pain should be referred to the PT, or those with gross motor problems, like those with problems with gait, walking, balance, turning in bed. Okay. Next, the occupational therapist is the professional responsible for those with concerns related to fine motor skills, like a patient with rheumatoid arthritis with a 1-month-old baby, those who have difficulties in activities of daily living, like those who have difficulties in buttoning a shirt, tying shoelaces, and those with problems with high-end coordination. Okay, next, speech language pathologist is the professional responsible for the assessment, diagnosis, and treatment of speech disorders. So patients with dysphagia and those who are post-stroke, including those with difficulty smiling, should be referred to the speech language pathologist. Next, the special education teacher is the professional responsible for working with patients with learning disabilities, like patients with cretinism, and mental disabilities or emotional disabilities, like children with autism spectrum disorders, as well as those with physical disabilities, like blind children or children with muscular dystrophy and hearing problems. Next, the audiologist is the professional tasked to diagnose and treat hearing or balance disorders, like post-bacterial meningitis patients should be referred to the audiologist. Now, those also have tinnitus, or who would usually put their TV too loud, or those with too much earwax and sudden hearing loss, should be referred to the audiologists, including the elderly above 60 and those in high-nose job like in the military and construction work. The dietitian is the professional responsible for diseases that leads to malnutrition. For example, those with DM and Hirschsprung's disease should be referred to the dietitian. The endocrinologist is a doctor of medicine who specializes in diagnosing and treating disorders related to hormones and the organs in the body that produce the hormones. So patients with osteoporosis, pheochromocytoma, and diabetes mellitus are examples of patients who needs the help of the endocrinologist. Now, the immunologist or the allergist is the doctor responsible in the diagnosis and treatment of health issues related to the immune system. So those with eczema, okay, hay fever, and allergies like latex allergies should be referred to the immunologist. Next would be the urologist, okay? So these are medical professionals who are responsible in the diagnosis and treatment of diseases of the urinary tract for both men and women. So patients with kidney stones who are having prostate cancer or problems with infertility, including those with frequent urinary tract infection, should be referred to them. The psychiatrist is a doctor of medicine who specializes in mental health issues, including substance abuse. So they can prescribe medication, they can perform shock therapy, and you may refer patients with schizophrenia and those with bipolar disorders to the psychiatrist. Next, the psychologist is not a doctor of medicine. They are usually those who holds a master's or a doctorate degree in psychology. They primarily provide psychological treatments. So in essence, you can refer patients with behavioral problems or those with anxiety disorders and depression for treatment and psychotherapy. So next, the rheumatologist is the professional who is responsible for diagnosis and treatment of diseases of the muscles, the joints, including the ligaments like SLE, rheumatoid arthritis, and Sjogren's syndrome. So they can implement non-surgical treatment for these conditions. The sports medicine expert is a doctor of medicine, could be a doctor of medicine who is responsible for the diagnosis and treatment of injuries associated with sports activities like osteoarthritis and tendinitis, like the tennis player who have difficulty holding the racket should be referred to them. Now, the orthopedic surgeon is responsible for surgical interventions on bones and joints. So they are doctors of medicine. So you can refer patients with osteoarthritis, fractures, and those with carpal tunnel syndrome. Next would be the dermatologist, who is a doctor of medicine, is responsible for diagnosis and treatment of conditions of the skin, the hair, including the nails. So those with psoriasis, acne, hair loss, or eczema or atopic dermatitis should be referred to the dermatologist. That's the last one, and that's a blast. Okay. And that ends our PECHA KUCHA for today's session. That's PECHA KUCHA number 7, the concepts that you need to remember for multidisciplinary, interdisciplinary, or transdisciplinary team and conference. Okay, so if you have any questions that you have in mind, let's learn together. Send in your request to my email, mentor.raygapuz@gmail.com. If you want me to cover other concepts in the future, please feel free to send me an email. See you in the next video.